8 Early signs of throat cancer that you mustn't ignore. Early detection of throat cancer greatly increases your chances of overcoming it. For this reason, although you might not be a high risk for it, it's important to know the initial symptoms. This type of cancer compromises the health of the pharynx, larynx, esophagus, or tonsils as a result of abnormal cell growth. Although it can affect anybody, the people with the highest risk of developing it are people who smoke or people who have suffered the human papillomavirus, HPV. Some of the signals that could be useful for early detection. 1. Hoarseness or changes in your voice. Abnormal cell growth in the throat can start at the vocal cords. For this reason, one of the first manifestations of this disease is a notable change in the tone of your voice. Prolonged hoarseness for more than 3 weeks, or a sudden change in your voice, are sufficient reasons to visit a doctor. 2. Pain in the throat. It's difficult to consider a simple throat pain as a symptom of cancer. Often, this irritation is caused by an infection of common respiratory illness. The appearance of tumors in this area can cause the reoccurrence of the symptom. It may also be more intense when swallowing or shouting. 3. Bad breath. If you have bad breath and it doesn't disappear with good oral hygiene habits, it could be a sign of something more serious. Although you don't have to immediately jump to conclusions, you shouldn't rule it out, either. Patients that develop this disease tend to have a lot of difficulty controlling the smell of their breath. This persists even though they might use mouthwashes or special oral hygiene products. 4. Difficulty breathing. Difficulty breathing, also known as dyspnea, is a symptom that might signal an obstruction in the respiratory tracts. It can be caused by a serious infection, but also could be a sign of tumors. 5. Swelling in the neck. The appearance of bulges in the neck can be caused by various things. In this case in particular, it tends to occur because the tumor has managed to spread to the lymphatic glands located around the throat. 6. Persistent need to cough. Patients with respiratory problems or allergies tend to have recurring coughs due to the response of the immune system to the presence of a foreign agent. At first, it may appear to be a dry cough, accompanied by irritation. Then, when the tumor advances, it can cause ulcers or bleeding. 7. Noisy breathing. When the tumor isn't addressed early, the cancerous cells continue dividing and causing great pain in the surrounding tissues. This noise is known as laryngeal stridor and is the result of a tightening of the opening between the vocal cords. If it's not treated early, the cancer could block it completely and cause asphyxiation and death. 8. Difficulty swallowing. The majority of patients with throat cancer begin to suffer significant weight loss due to a difficulty in swallowing food. The presence of tumors narrows the esophageal opening and causes food to get stuck. This, in turn, causes muscular weakness and increases the recurrence of acid reflux. After identifying these symptoms, it's crucial that you go immediately to a specialist.